Talk about that systemic link, that periodontal systemic link for me.
Well, just by background, I'm on the staff at Johns Hopkins Medical School, so I'm dealing with a lot of very sick people on a lot of occasions. It's very, very clear to physicians, particularly at Hopkins, that they realize that this constant showering of bacteria and endotoxin into the bloodstream into patients is a constant inflammatory burden.
Sure.
So it's something that needs to be addressed. Clearly, if we have people that are going into joint replacement or open heart surgery, all these kinds of comorbidities are looked at and need to be managed.
Right.
So it's a very real thing. There's no question about it. And what's good too is that the population in general is so much more aware of these kinds of issues.
Are you familiar with Dr. Wong, who's going to be speaking in next year's 2008 or 2018?
I am not.
I've heard from a few different people, and I'm not familiar either, but some of the stuff he's doing with salivary testing is just the cutting edge stuff. We're going to start, being able to diagnose on the early end of a slew of diseases. So I'm just curious how, and I know you get oral pathogens better than most because of what you do as a periodontist. I wonder how many of those cross-related things with the medical community we're going to start encountering, and they're going to want us. They're not going to have dental issues. They're going to have heart issues, diabetes, all these other things, and they're going to want us to do salivary testing to really kind of be as a screening tool and be the true preventionists that kind of we should have been all along, and we were in the beginning.
Well, see, what the salivary tests are going to be able to do, in effect, they're looking for inflammatory markers. And we're just seeing more and more chronic inflammatory disease states. That's having a huge impact on medical care, as was pointed out by Dr. Maples, I believe.
Yeah. So
it's a real issue, and we have an opportunity at this point to take a lead in management and diagnosing. People are seeing their dentists much more frequently than they are primary care physicians.
Absolutely.
So it's a great opportunity
Big responsibility
for us to take a lead in healthcare.